seen rural hospitals closing. If you're elected governor, what could you do in that position to
expanding
combat that?
Yeah, expanding Medicaid on day one,
Okay.
and that's gonna save rural hospitals and improving rural health. And we got to look at the communities of color are the ones disproportionately impacted by rural hospitals closing down. Some places have turned more to telehealth services, which are good, but they're only as good as the reliable Wi-Fi that exists in those communities. And so, in a lot of parts of our state, they don't have Wi-Fi, they don't have rural hospitals, and these are the building blocks of society. Having people healthy and educated, education and healthcare. This should be the basic tenets or metrics in which we can compare states. And South Carolina's been falling behind. We're at the bottom of those lists time and time again, and I believe it's because of failed leadership. We've got somebody in charge who's been in politics longer than I've been alive. And where's it gotten us? We've got rural hospitals closing. We've got people going bankrupt because of healthcare. We got the federal government offering to pick up the tab of 95% of Medicaid expansion, but he's still turning his back on that. So that's somebody who's from the past, a governor of the past, and we're looking to bring South Carolina into the future. And how it's kind of a model for other rural health centers and hospitals and how they're serving the community and going to where people are, with their mobile unit, raising awareness for cancer screenings. This is about elevating this in the conversation, and we've got a long ways to go here in South Carolina. We've got a lot of things we need to do, and it's been great getting on the ground and talking to them about expanding Medicaid and the things that can come from that. These are all things we've been talking about along the campaign trail as we do our 46 county tour. Understand the differences that may exist from county to county, but also there's a common thread here as well. And one of those is, that our rural healthcare has been lacking, but there are certain, hospitals and practices that are leading the way. I think this is one of them.
And what have you seen here that impressed you? We went into the mobile unit. We saw the Da Vinci surgical unit.
All of the above. The mobile unit, like I say, how it goes into the community, goes to where people are. And we've seen, as a result of COVID and even before, people may be reluctant or hesitant to go into a hospital or seek medical care, and sometimes you have to go to them. And I think that's one of the purposes of the mobile unit. The Da Vinci machine, an incredible piece of technology that's being used and saving money as well. The fact that somebody's able to have a hysterectomy and be out of the hospital the same day saves us a lot of money, and it becomes more efficient, makes it safer. So really, really interesting, cutting edge stuff too.